Good afternoon, good evening, good morning, wherever you are. My name is Albert Muraya. I want to welcome you to the July webinar hosted by ISSUP Kenya chapter. This is our third of our bi-monthly webinars, and we are co-hosted by ISSUP Global. Today's webinar is entitled Addressing Emerging Issues in the Area of Women and Alcohol Use. And we have two wonderful facilitators to lead us through the session. I'll introduce them just before they come on. One is Reverend James Mbugua, and the other one is Dr. Susan Gitau. But before I start, I'd just like to remind everyone that you're all muted for now, but you can put your questions in the chat box in the control panel, and we'll address all questions at the end of the session, after both facilitators have spoken. And this session, like all ISSUP webinars, is being recorded in the event that you need to leave early. So once again, from wherever you are, Kenya, whether you're in Kenya, East Africa, the rest of Africa, or the wider world, I welcome you on behalf of ISSUP Kenya. My name is Albert Muraya. I am the PR and media person on the executive committee. And so I want to introduce our two panelists. First of all, Reverend James Pogba. He is a counseling psychologist with a bachelor's and a master's degree in counseling psychology, and he is currently going through his PhD. He is also an international certified addiction professional level 1. He lectures at the African Nazarene University, and he is also an accredited counselor supervisor. He has a passion for all things substance use, in terms of substance use disorder, whether in support or training. And he is also an attached clergy with the Anglican Church. So over to you, Reverend Pogba, for your segment.
Thank you so much. I am really glad to join everyone this evening. For us in Kenya, it is evening. For some of you, it could be morning. I join you with a lot of passion and happy to know that all of us are fully excited to join this evening, this morning for some of us. And I will be talking about this wonderful area, and especially the concerns that has raised today's topic, women and alcohol use and the emergent areas. I want to straight away go to the point and start by asking ourselves, why are we really concentrating ourselves on the issue of women? The prevalence of drinking, according to the 2019 National Survey on Drug Use done in the US, reported 85.6% of people ages 18 and older that drank alcohol at one point in their lifetime. And out of this number, 51% were women. And that is part of why we have concern with this gender or with this category of people out there in the world. And specifically, the question, like I've asked, why women? For women, with continuous use or ingestion of alcohol, there is the risk factor for alcohol use disorder, and it is higher for women than for men. Number one, we note that for women who have 8 or more drinks, the risk for AUD is higher, while at men, it is only for 15 alcoholic drinks. So ladies and gentlemen, we find that a woman will only need to take 8 or more drinks in a week, progressively, and then along the way, she will develop or stands the risk of developing an alcohol use disorder. For us in the African context, and especially in the Kenyan context, issues of self-esteem occasioned by cultural dynamics may predispose women to alcohol use more than men. And why self-esteem issues? We find that in our African context, the woman is actually in a situation in which that her voice is not heard more often. And because of this situation, and coupled with the cultural dynamic,
I'm sorry, Reverend Mbugua seems to have frozen. Let me find out what is happening. Please bear with us. If you bear with us, we'll find out what has happened to Reverend Mbugua. Give us a few minutes, please.
hello, Albert.
Yeah, please go ahead, Reverend. I think you went offline, but you're back now. Please go ahead. We can hear you.
I wonder what's happening because my network is good. Sorry for that. I think it's the providers having issues. I want to give apology.
Yes, we understand. Please
So
go
I was
ahead.
saying that in our African countries, and especially including Kenya, women are increasingly assuming the role of the main breadwinner, leading to increased stress-related dynamics. Because when a mother has to provide or a woman has to provide everything, and then on top of that, they are the chief carer and the caregivers, you find that there is increased chances of stress, and this could push women to alcohol use. In the year 2016, of the 3 million deaths attributable to alcohol, we find that out of the 3 million, 12.6% of these fatalities were women, indicating that women are hard hit by alcohol use more than the men. We also note that sexual function and menstruation in women can be interrupted because of alcohol use. The effects of alcohol in women. Number one, birth defects. If a woman drinks excessively during pregnancy, her child may be born with what we call FAS, or fetal alcohol syndrome. This condition results in birth defects, which includes a small head, heart defects, a shortening of the irids, and various other abnormalities. As the children grow older, they may develop various developmental disabilities. The prevalence is high for women using alcohol in the following areas. Number one, domestic abuse and divorce. In our Kenyan context, and also largely African context, a woman who is not sober is at high risk of domestic abuse because they can't protect themselves. And because of the cultural dynamics, oftentimes you find our society frowning at women who drink alcohol. And that happens so often. For men, it is perceived as if though it is okay, but for women, there is a frowning on alcohol use, and this could bring separation, divorce, and the end to somebody's marriage. Women using alcohol has also been noted to have high risk sexual behaviors. They cannot negotiate their position, and especially when they are in entertainment joints, having fun, sometimes they are not in a position to negotiate for their safety. And together with this, you find that this can also lead to multiple sexual partners, unprotected sexual use, and also sex with high-risk partners. Here in Kenya, in a study that was done in 2019 and 2020, it was found that injection drug users and commercial sex users were having sex with high-risk partners, and sometimes because of alcohol use. Then there's exchange of sex for money or for favors. A woman with a child wondering where to get their house rent, where to get their food. Sometimes they have been known and recorded to exchange sex for monies or favors. Specific concerns why women is because exposure to alcohol in the womb can lead to fetal alcohol syndrome, the #1 preventable cause of mental impairment. Because the developing fetus inside has what we call the embryonic cells that will eventually form the brain, and these embryonic cells are multiplying and forming connections. Alcohol exposure in the womb can damage these cells, and finally causing the child to be born to have brain damage. When babies are exposed to alcohol in the womb at any stage of pregnancy, and we need to note this, ladies and gentlemen, at any stage, they have more difficulty later in life with learning, memory, and attention. Sometimes you have heard people asking, which stage is safe for a woman to use alcohol? Research indicates never ever when a woman is pregnant. Many of the children of alcohol using mothers are also born with a smaller than normal head and facial abnormalities. Because research and researchers have not exactly told us how much alcohol a mother has to drink to cause harm, doctors, and especially in the Western aspect, recommends that pregnant women abstain from drinking alcohol at any stage during the pregnancy. We also note that alcohol-dependent pregnant mothers also face the possibilities of a difficult labor. When they are giving birth, researchers also indicate that there is a tendency of facing a difficult labor. For women, once again, in our Kenyan local context, there is a high possibility of losing friends, losing their families, and losing their jobs because of alcohol use. This allows due a tendency for antisocial behavior, which causes their friends to avoid them. Like I said earlier, our environment is not very friendly to alcohol use by women. and they will shun them, and this may lead to the loss of friends, loss of families, and at the workplace, the loss of their jobs. We also note that women are affected by alcohol more rapidly because they tend to have a higher proportion of body fat than men, so they absorb up to nearly 30% more alcohol in their bloodstream than men of the same height and weight who drink the same amount of alcohol. Further, research from different sources indicate that women develop alcohol-induced liver disease over a shorter period of time and after consuming less alcohol than men. Number two, women who drink and drive are at a greater risk than men for fatal accidents at the same blood alcohol concentration. About 40% of women and men also who begin drinking before age 15 will be diagnosed as alcohol dependent at some time during their life. And 40%, ladies and gentlemen, is a very high prevalence. Finally, women who are sexually or physically abused as children are more likely to have alcohol dependence problems as adults. Once again, I want to go back to the Kenyan context. Because of the lapse and the gaps in our legal system, you find that there is more sexual and physical abuse for young girls more than for the young men. And because of this, the trauma that is occasioned to the young girls later on has been shown to lead to alcohol dependence for women more than for men. Even as we reflect on this as professionals in the addiction field, probably we may also need to consider what else do we need to do for the girl child because of sexual and physical abuse so that we can temper the happenstance of future alcohol dependence among the women. Increased alcohol consumption is directly related to increased diagnosis of breast cancer. Once again, research tells us, ladies and gentlemen, that for women, as they take more alcohol, there is a likelihood of an increase of developing breast cancer later on in life. Heavy drinking causes brain shrinkage in both men and women. But once again, for reasons that we may not fully understand now, it happens more rapidly in women. Alcohol-dependent women are nearly 5 times more likely to attempt suicide than women who don't drink. And that's quite a high figure, 5 times. As I currently speak, in the last 3 months, in Kenya, we have noticed and noted over 483, or specifically 483 deaths that have been caused by suicide. Some of the reasons that are coming out, though this is an ongoing research, is that for women, stress-related issues leading to alcohol use have been reported as some of the reasons. And this is so current because this is something that has been going on, and the deaths by suicide were actually reported yesterday in the last 3 months in our nation here in Kenya. Ladies and gentlemen, there is a reason why we are here tonight, and probably my co-presenter will tackle more, and especially in the treatment area. Thank you so much, and welcome.
Thank you, Reverend Mbugua, for your presentation, opening up this conversation about women and alcohol use. It was most enlightening, and I want to remind the audience that they can put in their questions in the control panel, or any comments you have that you want to make. So thank you so much, Reverend Mbugua. That was a great opening. And so now it's my pleasure to introduce his co-presenter, Dr. Susan Gitau. Dr. Susan is founder and director of Elewa Ulevi. Elewa Ulevi is the Swahili for Understand Addiction. It's a consultancy where she offers outpatient services both to individuals and to families who are affected by substance use disorder. She is a global master level trainer in the Universal Treatment Curriculum. She's also an international certified addiction professional level 3. And Dr. Susan is a frequent facilitator on Kenyan TV and radio on matters of treatment and prevention. She is also the vice president of the ISSUP Kenya chapter. She's the she's a chairman of the Kenya Red Cross Society in Kiambu County, and she is the 2018 winner of the ISSUP Demand Reduction Excellence Award, which we're very proud of. She supports a community and outreach programs on alcohol and substance use, both in educational institutions in the private and public sectors, churches, and she's an expert on employee assistance programs. So with that, Dr. Susan, I welcome you to your segment. Karibu.
Thank you so much, Albert. Good morning, good afternoon, good evening. Welcome to my presentation. I feel that we still need to know we are in these COVID times, whereby we know what is happening in COVID times. Everything changed in my country when COVID came in. So a lot of our way of doing things, how we thought things should be changed. And therefore, I hope we can still keeping safe, all of us, due to COVID-19. And I'm also aware that it's not only in Kenya, but everywhere that happened. And a lot of things happen. I'm trying to see my own screen, or there it is. So I wanted to talk about coronavirus and saying that what it changed our citizens to, the issue of violence at home, our poor socioeconomic status, all those things that Reverend has talked about, including early sexual exposure, pornography, child labor, freedom with no control. All this has really affected issues of substance use, especially to children and women. So we know that drug abuse is of immense concern globally, and particularly in our third world countries. The UN Secretary General Kofi Annan, in his report for 2000, says that substance abuse brings in millions of families around the world every year. So we notice that this promotes a lot of exploits and misery for their own commercial gain. So in Kenya, like any other developing country, we have noted that, why is it asking me what I want to be? Sorry about that. In Kenya, like all other developing countries, we noted that there were other issues that we had. We are talking of the drug and substance abuse, HIV/AIDS, poverty, and we have to contend with this right now. But we notice that these problems are also very much intertwined with a threat on the family, whether it's schooling, stability of the family institution, and the society at large. And as time is going by, what we are noticing is more and more young people are also getting hooked to alcohol and drugs, and this cycle is going on and on. So, oh no. So according to the National Institute of Drug Abuse Scientists, we have noticed that the use of substance, my screen is going off. Wait a minute, sorry about that. Excuse me just a little bit, I sort this out. Finally, thank you. We discovered that women who use drugs can have issues related to their hormones, their pregnancy, breastfeeding, and menopause. Interestingly, women themselves describe unique reasons for using drugs, including but not limited to controlling weight, fighting exhaustion, coping with pains, and attempts to self-treat mental health problems. So we know women often use drugs for mood regulations and stress reduction, while men are more attracted to the risk-taking aspect of drug abuse. So these are the points we need to note about women. Women are more likely to drink if they have problems with a loved one, whether it's their own spouse, their partner, their child, or even their parent. So alcohol problems are more common in women who are married, divorced, or separated. Interestingly, women whose husbands have alcohol problems are also more likely to drink themselves. So either way, women are really using alcohol. So as Reverend said, women who have been sexually abused, they are more likely to drink excess in a way of trying to find whether they can heal the trauma or feel better about the trauma they have undergone. So we also know women who start out drinking, they tend to start out drinking as a younger age than men who are of the same age. The sex and gender differences in substance use, we find that women often use substances differently than men, such as using smaller amounts of certain drugs for less time before they become addicted. I'm sure we are all aware of telescoping. Women can respond to substances differently. For example, they may have more cravings, and they are maybe more likely to relapse after treatment. So sex hormones really interfere with women and therefore make them more sensitive than men to effects of some drugs. And women who use drugs may also experience more physical effects on their heart and their blood vessels. Brain changes in women who use drugs can be very, very different from those of men. The issue of gender-based violence. We are told more than 1 in 3 women have experienced those physical violence in the hands of that intimate partner. It could be anything from slapping to pushing to shoving to severe acts of being beaten. Victims of violence are like obesity, chronic pain. So, number of time. So, 4 or more drinks in less than a 2-hour period. Therefore, binge drinking is becoming an epidemic in our bars and in college campuses, and it is increasing steadily as I speak. So in 2013, we were told 40% of white women, over 10% of Hispanic women, and less than 10% of Black women were found to binge drink. That is what research is telling us. So the alcohol use is quite common among women, and we are told nearly half of adult women report drinking alcohol in the past 30 days. That is approximately 13% of adult women. They report binge drinking, and on average, do so 4 times in a month, that is consuming more than 5 drinks per binge. And about 18% of women of childbearing age, those between 18 and 44 years, also they binge drink. So in 2019, research is telling us about 32% of female high school students consumed alcohol, compared to 26% of their male counterparts. Now, binge drinking was also more common among female, that is 15%, than male, 13% of high school students. So in 2019, 4% of women overall and 8% of women aged between 18 and 25 had an alcohol use disorder. So alcohol among women in Africa. So in Africa, traditionally, it has been quite low, and high rates of lifetime abstinence persisted in most or many of African countries. However, population-based surveys have documented rates of alcohol use and harmful drinking among African women that raise concern, including what we are calling episodic binge drinking and regular high consumptions. So prevalence of alcohol use in the past year among women was estimated at 30% in Botswana, 47% in Namibia. Heavy drinking was also found in 38% of women currently drinking in Nigeria, and 20% among current female drinkers in our neighbors here, Uganda. So the negative consequences of harmful alcohol use are illustrated by studies that identify women alcohol use as a risk factor the infection in Uganda and South Africa. For the limited evidence available, we are aware that we have very little research based on women. We notice that factors associated with alcohol use among women in low or middle income countries included that of being single, high socioeconomic status, and high levels of education. Whereby most of us would imagine if this women have high education, then they would be more aware of the consequences of alcohol use. Contrarily, they are drinking more. So what challenges are going on with women? One is poor interventions, where there's a lot of shame, which is inflicted into one who is already suffering from such shame and guilt. Therefore, she becomes more defensive and defiant. Second, if proper screening is not done, women will usually lie about what drugs they are using and how much they are using. We know most rehab programs are mostly male-oriented. Women do have special needs, and these are rarely addressed. Therefore, I think we need to have special encounters forums where these issues of women should be expressed. Comorbidity normally is not addressed, and even when it is addressed, for example, in mental health illness is addressed, screening for treatment for personality disorders are normally ignored. Counselors who direct group discussion on sexuality issues usually avoid, and yet these are key in most women concerns. Point number 6. Some that have experienced abuse and are drinking as a result of that abuse can't talk about such issues in a male-nominated rehab. So the possibility of them getting re-traumatized becomes very high. Tendency to have those mixed rehabs. In my country, I think we only have 2 female rehabs, and currently I think both of them are closed down because of the technicalities I'm going to talk about as I end this presentation. So we notice that those mixed rehabs, they compromise recovery for women. This lack of family involvement during treatment means that this client will not have any family or peer support once they leave. Dependency, this causes the family to push this woman back into the addiction. And when we are doing the proper discharge, you find that if it's not done well, this woman, when she leaves the post-rehab, she will tend to go back to what she knew, which is now relapse and using. So lack of support to attend other groups, whether they are GBV issues, parenting groups, or other groups, then she will tend to return to the situation that she was in post-rehab. Another thing that keeps coming up for women, where should she leave her children? If at all she's already agreed to go to the rehab. So in Kenya, things are like different a little bit because of the culture and what the society expects. So we find that women who drink, they face a lot of criticism rooted in their position as women in the society. They are seen to contradict the social ideas of what feminine behavior is supposed to be like. So an ideal Kenyan woman is a homemaker, and an alcoholic will ruin her home, marriage, and cannot take care of her children. So you find in Kenya societies, for example, my own Kikuyu culture, drinking was a male thing. And women would only be allowed to drink during very, very special occasions like wedding, negotiation. And even at that time, the husband's approval had to be sought. So she still will not drink. So, well, in some society or specific social situation, drunkenness defines who a real man is. For women, this is not the case at all. Kenyan society expects women to be in control of themselves on all occasions and in some well-defined social contexts. They need also not only to control themselves, but they also need to be in the control of their husband's drinking as well. So this is quite a big challenge for women. So, what are you expecting of this Kenyan woman? Kenyan women should not get drunk or smoke in public. They are very clear. Kenyan women should not display any sort of antisocial behavior. And there is always a social stigma attached to a woman in Kenya who abuses alcohol or other forms of drugs. So a woman drug abuser is seen to be a very bad mother, uncaring mother for her children, and irresponsible wife, and not considering the needs of her husbands. These are things that you might not hear out here, people talking about. But sometimes we need to talk the things truthfully so that we see where we are as far as women and alcohol is concerned. Another thing that really happens is that she's viewed as out of control of her domestic and work situation, or as an evil or a loose woman who cannot and will never be trusted. So already if this woman has this problem, stigma is already there, simply because of how society looks as a woman and the expectations of the society for this woman. So we find that women are less inclined to seek treatment for addiction. This is often due to the practical concerns about child caring and taking care of their families. At one point, I had a group of women before COVID who would come in for a group sessions where they would motivate each other to maintain sobriety. Mostly the men were drinking. They didn't have an alcohol problem per se, but their husbands had. So when they would come in, for those ones who you did an assessment and felt that they needed to go in for treatment, they will tell you, I'd rather die. I cannot go in because it will be a big shame for my family. I'll shame my church. I'll shame, so already they are already dealing with shame, guilt, then this comes up. So I found it was very, very hard for them to even accept when they had a problem that they wanted to look for that treatment. So women really do feel that there's more stigma attached to them when they use alcohol or other drugs. Therefore, many women will actually avoid treatment. Some, maybe they are too depressed even to seek for that help. They don't even know they can go for that help. So when women do actually seek treatment, they often have a harder time quitting. And research tells us they also have a greater rate of relapse following their treatment. Thank you very much. I want to end there and pass it back to Albert. Thank you very much.
Thank you, Dr. Susan. That really was informative, enlightening, and well presented. And I was hanging there waiting for more, and I'm sure there's a lot more that you could say. It is a very interesting topical area. My own experience as a treatment professional with women is that they tend to drink in secret, and so the deterioration in their condition is less visible than a man. And so by the time it is noticed that they have a problem, often brain damage has happened, and another organ damage. And so I welcome questions, comments. I think I only saw one question here from, or there are a few now. Sanu, it's more of a comment. She says she has noticed that she has noticed an upcoming trend amongst mature married women who drink heavily secretly. I guess this is what I was saying, at home, away from prying eyes. And it is a very worrying trend. I'm not sure where Sanu is writing in from. I don't know if that is Africa or Asia or where that is. But it concurs with what I was saying. Dr. Susan or even Reverend Mbugua, would you like to comment on that?
I would like to comment and say that women are closet drinkers, meaning that they are drinking behind doors. You might not see them in bars or in social gatherings, but most of them are drinking behind doors at home. And of course, hiding it even from their own partners or even trying to hide it from their own children. So that is happening a lot. Thank you.
Okay.
To add on that, but what is also happening is that there is a lot of expectation on delivering on the same terms for women like for men. And you find that being a woman itself is actually a very heavy responsibility. The expectation out there is that they need to catch up very fast. Yet somebody is a mother, the economic situations we are going through, the social expectations that have been there, and then of course the chores and responsibilities that the woman, especially a mother, has. If you add these together to the professional woman, then it becomes a very hard burden to bear. And for her to actually maintain the aura of success out there, the only place they could feel safe to take their drink to overcome some of the challenges they are going through is in the house, or as we say, in the closet, so that they can overcome some of the stresses they are going through. They have nobody sometimes to understand what they are going through, and they end up doing it in secret because there will be an issue, and especially within our societies.
So the issue of stigma and social expectation is double-edged. It leads them to drinking in secret, and then that rebounds on them. Thank you for that. So Dr. Teresia Njora from Baraka Therapeutic Home makes a comment that the biggest challenge with women seeking help from rehabilitation centers is that many are unable to pay rehabilitation charges. The families take women for prayers instead of taking them to rehabs. If rehabs could get funds from donors or other sources to fund the treatment of women, it would be easier for them to seek treatment. I'll also add to that for women to go into residential treatment is particularly problematic because of it. Both of you mentioned the issue of taking care of the children. Would you like to comment on Dr. Teresia's comment about paying for rehab? She's saying that society is less willing to spend the money on paying for the treatment of women than, I guess, for men.
Already society has stigmatized the woman, and this woman finds it's very, very hard to seek help because of the stigma. Then in our context, what follows is that you find that a great percentage of the women who are using alcohol, like Dr. Gitau reported so well, is that they are single. Then they are also of the higher economic levels. They also have higher education. So you find because of this, they will sit and listen that I am not the type to seek help because after all, I am educated, I am in a high economic status, and then of course being single, whom do I leave the children with? For the lower economic group, yes, there is need to address the issue of funding. Rehabilitation treatment inpatient in Kenya is quite high. And the only worthwhile public institution that we have is only one, although today the level 5 hospitals are having units for the same. But of course, in public settings, the issue of acceptability may not be very high because of the staffing issues that we'll have on the ground. So yes, there's need to talk and reflect on how do we get funding for the woman out there who may need help.
Thank you, Reverend Mbugua. A related question or comment from a number of the listeners is related to how to get women into treatment sooner. 2 or 3 have asked a question along that theme. How can we encourage women to get into treatment earlier than is the case at the moment?
I think I want to comment on that, Albert. If we look back to when we realized that addiction was a problem in my country, initially it was also very hard even to take in patients, even by then the oldest rehab that was there, because people had not believed, they were not having that information that this is a disease that needs to be treated. So when that happened and people became aware, it was more of a man problem. We thought that men are the ones who had a drinking problem, and therefore slowly we have come to accept that it's okay to take a man or a young boy to rehab for treatment because they have seen others going and coming out clean, or better, sorry for using that word, coming out in recovery. So for women, we have not yet accepted that women can have an alcohol and drug problem. Even when you're getting a call and a referral, somebody's telling you, I want you to see a woman, even how they say it, you can hear in their voice, they are very ashamed of it. So in our culture, it's like we are saying you should not have this problem in the first place. So educating people, letting them know this disease doesn't understand the different sexes, religion, it doesn't care who you are. So that educating people and letting them know this disease can affect any one of us, and that women actually get addicted faster than men, because we know of women can use smaller amounts of alcohol but yet get into addiction faster in a shorter time than men, what I was calling telescoping. So maybe educating people so that they may understand that women are also prone, especially in today's society. They are becoming very highly educated. They are coming out, they are having their own money. They're having a lot of freedom unlike before, and therefore they are prone to be exposed to alcohol and substances and therefore fall into addiction. So we need to educate the masses that rehabilitation or treatment is for everyone, so that they can look at their parent or their sister or their auntie or even their mother and say, oh, there's something we can do about this. So currently, it has been normalized that a man having an alcohol or drug problem can be taken to rehab. We are yet to normalize that it should be the same for women who have the same problem. Thank you.
All right, so more and better education, more focused education. There was something which Dr. Susan, you mentioned about women not being identified through standard screening procedures for SUD, somehow being able to disguise their drug use. Here we're talking about alcohol, but drug use more generally also. From basic screening, I guess, I don't know if you're referring to primary health centers or what sort of settings you were talking about.
From the primary centers to the higher level centers like the outpatient programs. And why the women are not telling the truth is the same stigma, the shame, the guilt. So they will still not tell you how much they use. They will not still tell you what types of drugs that they're using. So what we are learning is that they will not tell you the truth because they're also afraid of what the society or the families or even the peers will say as far as them having an alcohol or drug problem.
As a practitioner, I wonder whether there are maybe certain things that you could guide us to look out for, particularly for women who may be abusing, that may not, say, apply with men.
For women, through practice, what I do is they need to really be reassured that what they are going through is a problem that somebody can be assisted to overcome, or they can be taught how to go about getting better. So the fact that you're able to listen to them more, allow them to express themselves, because women tend to really, if they trust you, to express themselves more, so that they will not see the need of hiding. The issue of the person who brings them matters a lot, because the person who is bringing them might be condemning them, of course, talking everything bad about them. So their self-esteem is normally almost at zero. So it's a lot of work working with them so that they can feel comfortable enough so that you are able to help them and assess them better and get, of course, better treatment outcomes for them.
Mm-hmm. So make them feel more safe. And it sounds like it generally takes a little longer
yes.
to work with them at the initial stages. And then there was another point. You referred to the fact that there had been 2 specialist treatment centers for women in Kenya, both of which have closed. And I was just wondering, what can be done with regards to that? Because clearly the demand is there. The women who need help are there. Even for existing, rehabs that take in both men and women, what can the operators do to accommodate women specifically?
I think they need to come up with very special programs for women. And there's this point that keeps coming up when you're doing an assessment on women, the issue of the intimate partner, that violence. Some have experienced rape, sexual abuse, and therefore, when they go there and they find that the counselors are male, they are also interacting with other males who are in recovery when they're doing their group work, or when they're doing their lunch or their morning prayers or all that, and they interact here. Some feel very unsafe, and therefore that's when I was talking of them being re-traumatized. And sometimes when working with the normal group sessions and somebody brings up the issue of rape, and maybe in the larger group people laugh about it and somebody has gone through it. So you are re-traumatizing them and telling them like they were the problem. So we need to be very careful with programs that we put down for women. We need to be very sensitive on their issues, which can cut across from how they look, how they talk, how they present themselves, where they are, their cycle, what they are dealing with their menses, whether they are in the early stages of menarche or they are in the process of becoming their menopause. So all these things will interfere with the women. So we need to have very specific programs that are focused on dealing with women issues. And that's why the female rehabs would work very well, because here they would not feel ashamed talking to the counselors there. They won't feel ashamed relating with the others in the group session on issues that they have gone through. So definitely we need to have specific programs for women to cater for the women, and probably have more female counselors working with them if they are comfortable with that.
Mm-hmm. Mm-hmm. Well, thank you. It seems like it's a comprehensive issue. I'm just thinking that in Kenya, by far the majority of counselors and psychologists are women, but in substance use disorder, I think there are fewer women than men, if I'm not wrong. So that's an interesting thing. And I do remember when I was working in a residential treatment facility, we would have gender groups, and the men would take an hour, and the women would take 4 hours. Even then, we had to cut it short. Yeah, so clearly they had a lot to say and a lot to share. I don't know if you have any parting comment, both of you, Reverend Mbugua and Dr. Susan, as we come to a close. We could go on, but our time is up. So would you have a parting comment as we close?
Probably, Albert, on the issue of how we get more women into treatment, we may need to have deliberate campaigns on awareness about alcohol use and substances and the effects it has on our women folk. From the pulpit, the social gatherings, because as more people get to hear about what is pertaining here, they will now start shedding off the stigma and coming for treatment. And once they come for treatment, right from the primary care centers, including our hospitals, because sometimes this is where they will report first, even before reporting anywhere else because of what is happening. And then, together with this, we'll also need to be very careful to listen to the comorbid issues. Our women, and especially today, the college students and those who are doing well, they are doing it on 2 levels. The comorbid issue of alcohol and other mental conditions. No, we need to tell the society out there that alcohol use disorder is a mental condition and it can be approached from that level. And then, of course, for the use, when they want to actually cover their steps, you'll find alcohol oftentimes going together with cigarette smoking and with other heavy drugs. And if we are very deliberate in the campaigns, we reach them out there in the society, we let them understand that they can get help, we let them understand that, yes, being a woman doesn't mean you can't be helped. And you also deserve to be helped. And for those who are in treatment, the issue of the assessment, listen very keenly as we do the initial history taking, as we do the assessment. Listen to the story behind this woman. What are the children reporting, or what is being reported about the children? Because sometimes a mother would hide so much the use of alcohol, but then the child probably who has accompanied this mother is showing signs of trauma in one way or the other, malnutrition or other presenting issues. So listen and listen keenly so that we can explore and get the ready to tell their story so that we help. And for us also in the treatment field, let us train more ladies in this field so that they can help us to work with our sisters. At the end of the day, they are our mothers, they are our sisters, they are our wives.
Thank you, Reverend Pogba, for that summary. Dr. Susan, is there anything you'd like to say as a parting shot? Dr. Susan, can you hear me? Perhaps not. So we've come to time, and so I want to thank everybody for your participation, the number of good questions that we have received and comments. This is a topical area. I guess we cannot exhaust it in an hour, and perhaps it's something that we will revisit at another time. So on behalf of ISSUP Kenya, I want to thank ISSUP Global, the team there, for assisting us in hosting, in publicizing these webinars. And for those who have attended, as I'll remind you that there is a recording. If you want to, somebody's been asking here about the notes. So there is a recording that will be emailed to you. And so I thank you once again for joining us, and look out for the next webinar, which will be in 2 months. So on behalf of ISSUP Kenya, I thank you, and God bless you all. Thank you.